Welcome, everyone. Jaime, are you ready to start?
I am ready whenever you are.
Okay. My name is Dr. Kelly Deal. I'm the Senior Director of Science Communication at Morris Animal Foundation, and it's my great pleasure to participate in this webinar today with a dear friend of mine, Jaime Modiano. Jaime and I did our residencies together several years ago, and we actually did our postdocs together at National Jewish Health. And we are one of the funders of the LyRA study, which we'll discuss today. And Jaime's been funded many, many times by Morris Animal Foundation, and we're so proud of everything that he's accomplished. And I'm really excited to listen to what he has to say about this exciting new study. So, Jaime, over to you.
Thank you, Kelly. Can you guys hear me okay? Give me a nod if you can hear me. Great, thank you. Thanks, everyone, and welcome. So as Kelly said, my name is Jaime Modiano, and I am one of the team members of the LyRA study, and the subname of this is Strategic Prevention of Canine Lymphoma to Promote Cancer-Free Aging. And this is really important as we think about ways to prevent cancer in our population, cancer being a disease that happens mostly in older people and older animals. We also want to be really careful that as we prevent cancer, we also think about all the other things that happen with aging. So let me see why my thing is cranky. For those of you who have never visited us, these are some pictures of our campus. So on my left over here, let me see if you can see my pointer. There's the arrow. So this is the College of Veterinary Medicine complex. So the action happens over here in our small animal hospital. This is where we see cases, run clinical trials. And this is our Masonic Cancer Center. This is the Masonic Cancer Research Building. My office is right there, and our lab is right there. And this is where all the cool science happens. One of the really beautiful things about being at the University of Minnesota is that my window right here overlooks a national park on the Mississippi River. And I think there's not many tier 1 research universities where people can say their window overlooks a national park. It's absolutely gorgeous. Okay, I have some disclosures that I have to go through very quickly. I have research funding from the Public Health Service, at least I do right now, NIH, DOD, also from foundations, the AKC Canine Health Foundation, Morris, the Venn Foundation, and also we are funded by private donors. I have equity interest in a company called Apologic Pharmaceuticals, not related to this. I'm a founder in a company called Companion Biosciences, formerly was called Canine Biotechnology. I'm a founding and managing partner at Veterinary Research Associates. We get royalties and licensing fees from several entities. I have inventor status and several patents, and we have ongoing collaborations with Oxford Biodynamics, which actually is collaborating with us on this particular study. And all of these relationships are reviewed and managed by the U of M in accordance to its conflict of interest policy to make sure that I stay on the straight and narrow. Okay. So the objectives of today's webinar is I want to describe the goals of the LyRA study. I want to provide information about opportunities that people have to enroll their dogs and have their dogs become participants. And perhaps most importantly, I want to align the expectations of potential participants, so those people who want their dogs to participate, with the project timelines. We are doing this precisely because of lessons that we have learned where when we do not set the correct expectations, then a lot of people can get cranky. So hopefully by the end of the webinar, you will understand what is required to participate. Okay, so the webinar has 4 parts. The first part, we're going to do a brief overview of canine lymphoma. And I will probably tell you some things that you know and maybe a few things that you don't. The second part, we're going to go through the goals and design of the LyRA study. The third part, we're going to describe all the steps of how you can actually enroll your dog to participate. And the fourth is going to be the expected outcomes, what we think is going to happen, and how we're going to report the results. All righty, so with that in mind, what do I want you to remember at the end of the next hour or so? first thing, I want you to remember that lymphoma is not one disease. There's more than 30 different types of lymphoma in dogs, also more than 30 in people. So lymphoma, not one disease. It's very important. The goal of this project is to develop a test that stratifies, and stratifies means organize or assigns. So stratification essentially means creating a ladder or grouping. So a test that stratifies dogs based on their risk for the most common malignant lymphoma. My wife asked me, why did you use that word stratify? Nobody will understand it, but the word is used repeatedly throughout the webinar. So I just want to make sure everybody's on the same page. Stratification is essentially arrangement or grouping. Okay. The third thing that I hope you'll remember is that the LyRA 3 study, which we're going to describe for those people who want to enroll their dogs, will include about 150 dogs, and those dogs have to meet specific eligibility criteria. And the fourth thing that I want you to remember is that there will be no reporting to the owners. In other words, when you submit a sample, you're doing it because of altruistic reasons where you want to help dogs in the future. When we run the test, we don't know what it means until the end of the study. And today, we do not have an intervention that would actually allow you to change any risk to the report. So if we reported something, we would not really know what we're reporting because we haven't finished the experiment. And you wouldn't be able to do anything about it. So that creates stress and it's not clinically useful. So this test will only be clinically useful once we actually know what it means and when we develop effective interventions that will delay or prevent the disease, which is our ultimate goal. So those are the four things that I want you to remember. So with that, let's jump into canine lymphoma, a brief overview. Okay. So lymphomas are tumors of cells that we call lymphocytes. Lymphocytes are part of the immune system, okay? And specifically, they are these three cell types. So we have natural killer cells. Let me see if where's my point. Okay. Natural killer cells, T cells, and B cells. And there's many, many flavors of each one of these, but in broad groupings, these guys are lymphocytes, and all of these guys outside the boxes are immune cells that are not lymphocytes. So tumors that originate from these guys here are called lymphomas. In dogs, we recognize more than 30 types of lymphomas, some that are very common. The most common is one that we call diffuse large B-cell lymphoma, which is this big piece of the pie. It's almost half of all dog lymphomas are diffuse large B-cell lymphomas. Other B-cell lymphomas like nodal marginal zone and Burkitt-like lymphoma or Burkitt lymphoma in dogs. And then a component of T-cell lymphomas, about 10 or 15% that are very aggressive and about 10% that are very indolent. And the only treatment they usually require is a pet in the head and a cookie. And then this accounts for 1, 2, 3, 4, 5, right? The other 25 or 28 or 30 lymphomas account for about this 15%. So they're individually, they're kind of rare. Collectively, they are about 15% of all the lymphomas, but individually, they're pretty rare. Okay. So, oops, sorry. What does it mean that we have different lymphomas? Where do they come from? So this complicated drawing is a cross-section of a lymph node or a lymph gland. So lymph glands is the place where your immune system prepares to fight infections and other foreign organisms and bad things. And the lymph node is divided into very specific compartments where things happen. So we have follicles, and let me outline a follicle for you. Let me find my pointer. Okay, so this is a follicle right here, okay? The follicles are present in the outer part of the lymph node, which we call the cortex, this sort of purplish colored thing, okay? And when we get tumors that arise from the follicle, we call that follicular lymphoma. The marginal zone is the area that lines this inner core of the follicle. And when we get cells that start in the marginal zone, we call it marginal zone lymphoma. Okay. The germinal center is where a lot of the action happens. So the germinal center becomes organized when B cells, that are the cells that make antibodies, see an antigen, a foreign invader, and they get very excited and they need to create more of themselves to go fight that invader. So the germinal center is where all that activity happens of making more B cells that are going to fight the invader. The mantle zone surrounds the germinal center. Okay, and so when we get cells that start from this surrounding area of the germinal center, we call it mantle cell lymphoma. And then the paracortical area is this light blue area. This light blue area is where most of the T cells live. So many T cell lymphomas start here, although we have T cells that run around here. And so this is actually a very sort of complex organization. But when we look at these, when we look at lymphomas histologically, we can usually tell where they come from, because if they come from the germinal center, which again is this area right here, they blow up. Imagine blowing up a balloon, and so the tumor is expanding outwards and compressing all this stuff going from inside to outside. On the other hand, if it starts in the marginal zone or in the mantle zone, it actually squishes the germinal center in, and it expands outward into the T cell zone. And if it's follicular lymphoma, it's really interesting because only the follicles get big. So it just looks like the follicles are in hyperdrive and the rest of the lymph node looks sort of normal. And for the T cell lymphomas, they tend to be sort of like just an expansion of this population without a lot of obvious proliferation, but some of those tumors tend to be really, really bad. So depending on where the malignant cell arises in terms of the structure and function of the lymph node, we have these different types of lymphoma, and each one of these has different behaviors. And to some extent, they have different prognosis, and in some cases, we might recommend different treatments. Okay, so the risk of lymphoma is intrinsic to cells that divide frequently. What do we mean by that? So this is an illustration that I borrowed from a paper in the Proceedings of National Academy of Science, showing the expansion and contraction of a cell population called CD8 lymphocytes. So these are the T cells that like to kill virus-infected cells after they see an antigen being, in this case, for example, a virus that's infected a cell. So this is essentially the cell that is running around, hasn't seen any bugs. Okay, this is the cell after it's seen the bug and now it's activated. And the first thing that it has to do is make a lot of itself. There's a lot of the invader, and it has to make as many of the as many cells as there are invaders or more to kill them off. And then once the T cell successfully kills off the invader, this population has to contract because you don't want all of these cells running around. So it contracts and it creates a memory population. And that's illustrated here. This first red line called priming is essentially the activation step. So the cells get activated to make more of themselves. This black line is the number of cells. So basically they increase quite rapidly. They fight off the invader, they decrease. But what happens here is that every time that one of these cells divide, and you can imagine that this particular cell is making identical copies of itself, so it's dividing a lot. It's not necessarily recruiting its friends. Its friends are doing the same thing independently. So it's undergoing a lot of cell division. And every time that a cell divides, there's the risk of introducing mutations into DNA, and that can actually alter the function of the cells and create malignancy. So cells that divide very rapidly and very often are at greater risk of turning into a cancer. So lymphoma is intrinsic to the cells that divide rapidly because, in fact, these cells are dividing all the times to protect us from organisms and other exposures. Now, lymphomas are not exclusively diseases of dogs. Lymphocytes, as we recognize them, first appear evolutionarily in what we call primitive chordates. So these are lampreys and hagfishes. If you happen to live in the Midwest, you might have seen some of these invasive species. They're kind of ugly and disgusting. But we have never characterized the lymphoma in these animals, even though they have lymphocytes. And it's probably because if they get lymphoma, they die, and they don't end up in fishing nets and other things. They end up in the ocean bottom or in the lake bottom where they're eaten by something else. But tumors of lymphocytes, so lymphomas, have been recognized in every vertebrate class. So fish, amphibians, reptiles, birds, and mammals. Lymphoma is a disease that happens across all vertebrates. But of all animals, it seems like lymphomas are most common in dogs. And there are some reasons why we think that is, but we're not going to go into them in great detail. Just to know that lymphomas are pretty common in dogs. So malignant lymphomas, which are the ones that we really care about, the benign ones are not so bad, but the malignant ones can be pretty bad. They're neither genetic nor environmental. So there might be some influence of ancestry, meaning breed, but that influence, as far as we can tell, is very firmly embedded in the canine genome and within breeds. So when you have a dog from a breed and you compare its risk to another dog from the same breed and another dog from the same breed, it seems like if that breed happens to have some elevated risk, the risk is equally spread across the breed. We have not really been able to document familial relationships where one family of one breed would have greater risk than others. There's been some anecdotal reports that would suggest that might happen. Some date back to the late 70s, have never been reproduced. So some were just reported anecdotally, but not with data. So it's really hard to know if that is true. Some people have suggested that there might be some geographic influences, which would point to either environment or close families where the dogs tend to stay close to home. But again, there's really no good data to actually support that. So right now, based on what we know, if there is any influence of ancestry or breed, it's distributed equally across the breed. And this is really important because we get this question a lot. My dog's great aunt, dad, mom, sibling, daughter, distant relative developed lymphoma or some cancer. And now I'm really worried because my dog's going to get cancer. So even though when you go to your physician, they ask you if there's cancer in the family and they're looking for these relationships, just because a dog that is related to your dog developed a cancer doesn't mean that your dog is at greater risk or at lesser risk for cancer. The risk of cancer is essentially individual for every dog. Okay. There are reports of environmental exposures that have been associated with lymphoma, but those have not been reproducible. And in fact, in a few cases, people have gone back and looked at exactly the same data and come up with a different conclusion. So it's a little bit of the answers in the eye of the beholder and the type of analysis. And we do not have any evidence that environmental exposures really are strongly associated with canine lymphoma. Okay. So lymphomas are diseases of aging, and this is data from one of our older data sets, but it serves to illustrate the purpose. So what we've done here is we've got 5 different breeds of dogs for which we had some representation, and we've got the age of dogs in years and the proportion of dogs that develop lymphoma. So all the dogs in this particular data set develop lymphoma at some point. So all of them are going to add to 100% at some point. And when you look, basically, lymphoma happens in dogs for the most part after they turn 5. Yes, we do see lymphoma spares no one, and we do see some dogs that develop lymphoma early on. But, the ladders really go up with aging and particulars sort of in the adult to senior population. And that's not only true for dogs, this is the same for humans. So these data are from the UK, but similar data are reported in the US and other places. And this is humans, and these are the different types of lymphoma that we recognize in humans most commonly. And what you see is that with the exception of classical Hodgkin disease, which has a sort of young adult onset peak for reasons we don't totally understand, most of the non-Hodgkin's lymphomas happen in people that are certainly over 5 and mostly over 50 or 55. So lymphomas are diseases of aging. And the most common presentation for lymphoma is a dog with lumps. This pup was actually a happy dog, but he is sleepy by because they're getting samples from his lymph nodes or lymph glands. And what you can see is that here's his ear, here's his muzzle, and you can see these big lumps. These lumps are lymph nodes or lymph glands that have been expanded because there's a population of lymphocytes, malignant lymphocytes that are growing in there. And they're really going all over the body. So you can actually see another lump right here in front of his shoulder. And so when you actually look at this dog, he's going to have lumps all over because the lymphocytes normally travel across the body. So they go from one lymph node to the next one to the next one. And when they find a lymph node that hasn't been taken over by the tumor, they happily settle in there and they grow. And so the tumor goes everywhere. And that's the most common presentation we see. So if you want to have a definitive diagnosis of lymphoma, you need to evaluate a tumor sample. And that is because there are some conditions that mimic lymphoma. The gold standard for diagnosis is to actually take a biopsy or take out a whole lymph node and have a pathologist look at it under the microscope and do some immunostaining. This, even though it's a gold standard, it's rarely used because there are both risks and costs associated with anesthesia, and the surgery is minor surgery to take out the lymph node, but there's still risk and costs. And so what most people have done, the common standard of practice for VetMed, is to do a fine needle aspirate where you put a needle into the lymph node and you literally just use a syringe to pull material out, negative pressure. You get cells, you can put those cells into the microscope. You can look at them, you can do immunostaining, you can do flow cytometry, which is commonly done, and you can use molecular testing for clonality. So Dr. Ann Avery really was sort of the one who started this trend. About the same time, the group from UC Davis, Dr. Peter Moore, started this. And so both of the groups at Colorado and Davis do this, as well as many other groups. And so this has really become the standard of practice. And this gives you a reasonable approximation of the type of lymphoma that you might be dealing with. Now, there are many treatment options for lymphoma. And our philosophy here is that the treatment should be tailored to the dog's tumor type. So knowing what the tumor is important because it will allow you to figure out which options might be better. It should be tailored to the dog's presentation and health status. So is the dog a happy dog with lumps or a sick dog with lumps? And that might really tilt you in one direction or another, as well as the family's preference. So different families have different goals for their pets' treatment. They have different expectations. They have different time commitments that they can allocate to bringing the dog repeatedly for treatment. They have different financial resources. Less than 10% of families in the US have pet insurance. So most of this is on the owner's or the family's dime. And then the tolerance for side effects. The treatments have some side effects, and some people are perfectly willing to tolerate those to get more time with their dog and a reasonable remission, and other people just don't have high tolerance. So the treatments include everything from watchful waiting, so we can see what happens. And for some tumor types, watchful waiting means that you never have to treat because the tumors are not particularly bad. So there are lymphomas that really require no treatment. Palliation, which means using a combination of drugs that will make the dog feel better, but we don't really expect it to control the disease. There are some instances where palliative treatment will actually control the disease, but they are few and far between. They're very rare. Or we can use essentially more aggressive therapies to try to get tumor control and remission. And again, our philosophy is that this decision should be made together with the family rather than us absolutely telling people what they should do. So when we look at the clinical behavior, we see really three types of tumors that behave somewhat differently. And one type is aggressive T-cell lymphomas. And so this graph is what we call a Kaplan-Meier curve. So this is time in months from diagnosis time 0, and then what happens over time. And then this is the number of dogs that are alive with that particular disease over time. So what you can see is that this black curve drops very rapidly. And these are dogs that receive any treatment, but it really doesn't matter if we concentrate to the most effective treatments for aggressive T-cell lymphomas. They tend to do poorly. So why that is and what we're doing about it is a different story that we don't have time to cover. Happy to answer those questions if people want to email. Another type that we see are what we call indolent T-cell lymphomas. And these are lymphomas that are not going to progress very, very quickly. And in fact, these data are from 2013. So the paper was published in 2013. The cases were collected between about 1997 and 2010. And what some people think, not all people, but some people think, is that if you treat these tumors they will actually do worse. So if you actually took these tumors and didn't treat them, this line would probably be flatter. In other words, fewer dogs with these indolent lymphomas might die if you chose to be very judicious about treatment rather than treating at the first sign of lymphoma. And so certainly that's something that's different now than it was 20 years ago. And then the third clinical type are most B-cell lymphomas. We see some B-cell lymphomas that are indolent and behave kind of like these guys, but most B-cell lymphomas are somewhere in between the indolent T-cell lymphomas and the aggressive T-cell lymphomas. Okay, and we sort of have a variety of treatments for these guys that can get dogs into remission and make them live a little bit longer. So if you draw a line from diagnosis to about a year, you will see that very few of the dogs that had T-cell lymphoma make it at a year, so the line is down to 0. About a third or 40% of the dogs with B-cell lymphomas will be alive at a year, and more than half of the dogs with indolent T-cell lymphomas. Like I said, this could actually be better. And if you look at 2 years, now there's very few of these dogs with B-cell lymphomas remain alive. And some dogs with the indolent T-cell lymphomas remain alive. And again, we can keep these guys out a really long time. Now, something that's really important to recognize is that if we diagnose dogs at the age of 9 or 10 here, by the time they get here, they're going to be 12. And so many of these dogs probably might have died from other reasons. So it would be unrealistic for us to say that we're going to take a 10-year-old dog that has lymphoma, we're going to treat it, and magically that dog is going to live to 15 or 18. So we have to remember that in addition to lymphoma, these dogs have other diseases that are associated with the frailty of aging. But what this tells us is that malignant lymphomas, the aggressive lymphomas, almost always progress. And that leads to either death from cancer or euthanasia because quality of life is declining. So in humans, dating back to about 1997, a product called rituximab was approved, which is an immunotherapy. It's an antibody that sticks to malignant B cells. Well, it sticks to all B cells, and it effectively kills them. So there have been products in the canine world that might be able to do the same. They haven't been widely adopted for reasons not really related to their clinical performance, but more related to their production cost, market size, et cetera. As more people want these, there might eventually be immunotherapies that are out there. There's a lot of testing going on for immunotherapy for lymphoma and other canine tumors. So something might actually cross the threshold and make it. The outcomes might be improved. But immunotherapy will probably also require chemo to actually be curative or to induce these profound durable remissions. And immunotherapy has risk of serious side effects, including death. So for people that say, why isn't my dog being treated with immunotherapy? It's great. It's part of the natural system and my dog is going to do great. Immunotherapy is really powerful, and when we lose control, it can actually lead to death. So what we say is that the best lymphoma is the one that never happens, right? So if we don't have lymphoma, we don't have to treat it. So that's a really good segue to go into the LyRA study. What are the goals and how is the study designed? So let me repeat. The best lymphoma is one that never happens, and that's exactly what we want to do with LyRA. We want to actually make lymphoma never happen. So our principal goal is to reduce the burden of lymphoma in dogs and their human families, both the health burden, the financial burden, the emotional burden. So a diagnosis of lymphoma in a canine companion has serious negative physical, emotional, and financial effects on the patients and their families. So obviously the negative physical effects are mostly on the dog, the emotional, financial effects on the family. And the best way to reduce the burden of lymphoma is to prevent it from happening altogether. So it's important for us to note that dogs of all breeds and mixed breeds can develop canine lymphoma, although there is some information out there that I think leads to many misconceptions. One is that, in fact, there might be some breeds that are at greater risk. So we do tend to see lymphoma more commonly in some breeds. However, no breed is protected or privileged when it comes to this disease. It can happen in any dog. And the dogs that we tend to see more often are also the most popular breeds for the most part. So we don't tend to see sort of aggregation of lymphoma in breeds where there are only a few dogs. We tend to see it in breeds that are very, very popular. And a lot of the studies that have been done over the last 40 or 50 years, the databases are biased by that breed popularity. And so one of the things that you notice is that as breed popularity changes, the incidence of lymphoma or the perceived breed risk or predisposition tends to change with that popularity. So I think some of the idea that some breeds tend to be, I've heard students say lymphoma factories, really has to do with studies based on biased databases and also breed popularity. This tends to assumptions that are not well-founded, and oftentimes those assumptions now are amplified through social media. And so this really leads to many misconceptions. And we find that when we talk to people about lymphoma, there's a lot of education that we really can and should be doing better to try to counter some of the bad information that's out there. Now, one thing that's really critical for the LyRA project is that lymphoma requires a suitable environment to grow and to thrive. So I told you that lymphomas grow in lymph nodes or lymphoid tissues. And they require a supportive environment that's present in those tissues to survive. So if we take lymphoma cells out of the lymph node and we try to grow them somewhere else, for the most part, 99.999% of the time, those cells are just going to die. So you take them out of their house and they don't really know what to do and they die. And interestingly, when you look at the lymph nodes, and particularly the lymph nodes of a dog with lymphoma, less than 5% of the cells in that lymphoma tumor make up the supportive environment. So it doesn't take a lot of this sustaining environment to actually make the lymphoma grow. This might be a good thing because it might be that we don't have to remove a lot of material to make the lymphomas unhappy and unable to grow. So what is this lymphoma permissive environment, or this environment that allows lymphomas to grow? Well, it's not really well defined, and that's part of our goal. But this slightly complicated graph might tell you what we're looking for. So what we're looking at here is cancer incidence as a function of time, and looking at things that people have thought were associated with cancer. And so the first thing that people noticed is that cancers carry mutations, and they carry specific mutations that are associated with the cancers. And so the idea is when you have that mutation, the cancer is going to arise. Well, it turns out that data from the last 5 to 10 years has shown us that mutations accumulate rapidly during development. And they continue to accumulate through the life of individuals, but obviously not as rapidly. And when you look at healthy normal tissues and you compare those to tumors from those tissues, the mutational burden of the normal cells is almost the same as that in the tumors. So mutations are important for the development of cancer, but by themselves, they are not sufficient. Other people have proposed that the number of divisions in a stem cell create a risk for cancer. And I told you earlier that more divisions lead to more mutations and therefore risk. And so that is true. More divisions lead to more mutations and therefore risk. But the cell division alone is not sufficient, because we have a lot of cell division pre-birth and during development that rapidly declines as we get to puberty and then basically tails off. And so what you can see is that as we increase the rate of mutations rapidly and we have high proliferation, we have very little cancer. So cancers that happen in this particular neighborhood would be the pediatric and adolescent and young adult cancers that are pretty rare. Okay. And as we hit a particular age, we see that cancer increases. And with that increase, we actually see that there is a decline in our overall fitness. And by fitness, I don't mean the ability to run a marathon, although that's probably part of it, but this includes fitness of our cellular environment. So our immune system is less active, less able to fight things. The stromal environment where cells sit is now more able to support cancer and less able to fight it. So the relationship between aging and cancer is associated not only with the number of divisions and the number of mutations that cells accumulate, but also with a lower ability of us to reject those cells or prevent them from growing as we get old. So what we are trying to do is to define what this sort of nebulous fitness decline means by defining the environment that reflects declining fitness versus healthy fitness, and trying to see if we can actually reverse this decline so that we prevent the cancer from growing. Okay, so the lymphoma permissive environments, as far as we can tell, include diverse cell types, and we infer that based on the cells that we find in the lymph nodes where the lymphoma cells are growing. So they include macrophages, structural and progenitor cells that sort of make up the environment, the glue and the cement where cells grow, and these cells include things like fibroblasts, muscle, fat, endothelial cells that bring in blood, so they make blood vessels, and of course the immune system. And all of the components of this particular neighborhood are necessary for lymphomas to form and grow. If we remove any of these components, it's hard for the lymphomas to grow. Of course, we don't have therapies that magically remove these components. We do have some therapies that selectively might reduce them, and many of them are being tested in the clinic. Can we really do this? Can we actually take a dog that is aging and has cancer risk and define its risk? So the answer is yes, we can. And these are data from our Shine On project, which was also supported by the Golden Retriever Foundation in collaboration with the American Boxer Charitable Club and the Portuguese Water Dog Foundation and the AKC Canine Health Foundation. And what we did here was we focused on hemangiosarcoma, but it turned out to be sort of a pan-cancer test. And so we were able to actually define patterns that allowed us to segregate dogs into dogs that had low risk in the green and high risk in the red. So what are we looking at here? We're looking at time on the horizontal axis, and we're looking at the proportion of dogs with cancer on the y-axis where no cancer is 100%, and cancer means that the number of healthy dogs is declining. And so what we see here is that dogs that we assign to the high risk from a very simple blood test actually start developing tumors within about a couple months. And by about 500 days or a year and a half, 25% of these dogs have developed cancer. Whereas, somewhere in the neighborhood of 5 to 10% of these dogs have developed cancer by about the same time period. So this goes out to almost 2 years. A year and a half would be right around here. So this is great. We can define risk. Of course, remember, we talked about tolerance before. This means that if your dog tests at high risk, it has 75% chance of not having cancer in 2 years, 25% chance of having cancer. Your dog tests low risk, it's got a 95% chance of not having cancer in a year. Okay, so that information is great, right? Until you actually are faced with getting the information and somebody tells you, your dog is at high risk for cancer. Go have a nice day. Well, that's not really good medicine. It just stresses people out, changes a relationship with a dog. So this idea of early detection or risk assessment without being able to do anything about it is kind of dangerous. So what we decided to do was to actually, at the same time that we were developing these tests, we developed an intervention. So this basically shows what we can do with the intervention. So what we've done here is we've taken dogs that tested high risk, and we've evaluated those dogs to make sure they didn't already have a tumor, because if you have a tumor, we need to treat the tumor, we can't prevent it. So this is really emerging data. This is data from our first 11 dogs. And what we did is, this is what happens if you don't get the intervention. And these are dogs that got the intervention in the orange line. And what you can see, again, this is time to diagnosis from the last follow-up. This is the proportion of dogs that don't have cancer. So as you go down, you have dogs with cancer. And what you can see is that in the dogs where we had the intervention, we're seeing this really nice level of protection. There's a dog here that developed cancer at about 700 days. But otherwise, we're pretty much home free. So this is excellent. This is really exciting because it tells us we might actually have tools to prevent cancer in dogs that are at high risk. And again, the question is, what are people's comfort zones in terms of doing this intervention in a dog of a certain age where the risk is X, and there's a concomitant lack of risk for Y, or Y minus X. So, but at least here, if we actually tell you your dog is at high risk, we have the opportunity to do something about it. So then, of course, what people have asked us is, why not use this SOS test that we already developed to identify the lymphoma permissive environment? Why do we have to do a whole new thing? Well, the reason is that the SOS test was developed in a training set focused on canine hemangiosarcoma. That was the big question. And it works really well for hemangiosarcoma. It works across the board for many cancers, but it doesn't work as well for other cancers as it does for canine hemangiosarcoma. So when we look at dogs in our population from Shine On that developed lymphoma, some of them were assigned to the high-risk category, but not all of them were. So what LyRA will allow us to do is to create a lymphoma-specific test to evaluate the accuracy of a very different platform from what we're using in Shine On, and also to develop very specific interventions, because we do not know that the intervention we have for Shine On hemangiosarcoma will actually work for lymphoma. Okay, so we have proof of concept that we can do this. Now we need to do the same thing for lymphoma. And for those of you who might know, we're also doing it for bone cancer, osteosarcoma. That's a co-ed study. So the goals of the study: one is to develop a test that assigns dogs to groups according to their risk for developing malignant lymphoma. The second, that particular goal will use multi-omics technology, and I'll tell you what multi-omics is in a minute, to define what makes up the environment, as well as the abundance and distribution of those things that make up the environment. And the second thing is, from this information, we want to identify targets and create very specific interventions that delay or prevent the condition, meaning either the most common malignant lymphoma or perhaps other lymphomas. So the interventions will be designed and tested as part of future studies. LyRA does not include designing and testing the intervention, both because of time, budget, etc. Okay, so this project is exclusively designed to develop the test. There are 3 phases to LyRA. LyRA 1 is to develop the test platform where we will detect the lymphoma permissive environment, and I'll show you a little bit more about how we're doing this. LyRA 2 is to define when this lymphoma permissive environment emerges in relation to the appearance of disease. So with hemangiosarcoma, we believe that we can detect this risk environment somewhere between 1 and 4 years before the clinical disease happens. So our goal would be to actually do something similar with lymphoma, to find that the risk is present years ahead of the clinical disease, so that we can effectively prevent it. I just spilled all my water. And then LyRA 3, which is what we're going to be talking about more right now, is the phase where we're going to establish the capability of this test to assign otherwise healthy dogs, healthy adult dogs, to risk groups based on the identification of this lymphoma permissive environment. So if we go back to LyRA 1, in LyRA 1, we're going to use machine learning or artificial intelligence to identify patterns that create a lymphoma permissive environment. And we're using samples from dogs that actually have a confirmed diagnosis. So we have a dog, we have a diagnosis, the dog is not actively being treated. We take a blood sample, and that blood sample goes into the process of training, okay? So it includes about 150 dogs with confirmed diagnosis. From those dogs, we're going to take a blood sample and a poop sample, so fecal sample, and then we're going to run multiple tests. So we're looking at the 3-dimensional structure or organization of DNA, what we call chromatin. We're looking at sequencing, RNA sequencing. We're looking at accessibility of chromatin. So when you think of the DNA, what parts of the DNA are open and available or accessible for proteins to actually make RNA, and which parts are closed. We're going to look at, oops, sorry, I don't know what happened there. Let's try this again. Okay. We're going to look at sequencing the bacterial populations in feces. We're going to look at tumor cells. We're going to get bulk RNA and attack sequencing from the tumor cells. And we're also going to look at cell-free DNA. And this is going to be a lot of sequencing. And then we're going to actually integrate all this information using computers and algorithms to create the patterns that are associated with healthy dogs or dogs that are at low risk, which are the sort of yellow ones, and dogs that are at high risk. In this particular case, they would be dogs that have disease, and these are the red ones. And these are the patterns that we will then use to test other populations. For LyRA2, we're going to use golden retriever lifetime study samples to validate the signatures. So we're going to take dogs from girls that have developed lymphoma or other diseases over the course of the study. And we're going to look at them serially from enrollment all the way to when they develop disease and identify when we can actually see this lymphoma permissive environment come up in relation to when the disease happens. Okay, so it'll look something like this. We're going to get samples from Morris from the girl study that are going to include healthy dogs, dogs that have a definitive diagnosis of lymphoma, and dogs that have other conditions. We're going to take samples that were obtained at time point 1, 2, 3, etc. And we're actually going to look for when this lymphoma permissive environment appears so that we can identify both the presence and the emergence in relation to the appearance of disease. And finally, LyRA3, which is the one that hopefully you guys are willing to help us with, is enrolling 150 healthy adult dogs, get samples from those dogs, run the LyRA test, assign the dogs to a risk category, retest a defined number of dogs from this group, and then follow all of them for their lifetime or for a long time to actually see if our predictions actually match the outcome. If we say that the dogs are at high risk, do they actually go and develop lymphoma with high frequency? And if we said they were at low risk, do they not develop lymphoma, and for how many years? Okay, so it looks something like this. We test 150 dogs that are all healthy adults. We assign those to a risk group based on the test. We retest some of the dogs. We follow up all of the dogs. And then we look at the outcomes and we see how good is our test in terms of assigning dogs to a particular risk group. Okay, so how can dogs participate in the LyRA study? And this is being recorded and it's going to be available on YouTube, so you do not have to take furious notes because I'm going to go a little bit faster than you can write. Okay, so the first thing I want to tell you is, what will the LyRA test do? The LyRA test will actually help us assign dogs to specific risk groups. So that is the goal of the study and the test: assign dogs to specific risk groups, high risk or low risk to develop lymphoma. Okay, what will we need from you? We will need blood samples from 150 dogs, 1 dog per owner, and we'll reiterate this later. We will provide kits to your veterinarian, to your preferred dog's veterinarian, where we will obtain 2 different tubes of, or we will ask them to put blood into 2 different tubes and send it back to us. Okay, it is just as important to say what the test does not do. We get these questions a lot with Shine On and co-ed, so hopefully this will make sense to you. The LyRA test will not provide a cancer diagnosis in real time. So when you submit a sample, you will not get an answer that says your dog has cancer or might get cancer. The test will not treat cancer. So doing the test doesn't really impact whether or not your dog would develop cancer or how you would treat it. The test will not prevent cancer. Prevention would be a totally different study that we will do later. So there is no prevention associated with this particular study. And the test will not assess cancer risk in other dogs that are related to the dogs in the study. So whatever we find in the dog that comes into the study does not impact at all the risk of any other dog that might live in the household or that might be related to that particular dog. So these are, reasonable questions that people ask. And so we thought we would answer them first, and hopefully it'll reduce, or it'll help all of you understand what the test will do and what it won't do from the very beginning. Okay, which dogs are eligible? 10% of the participant slots are reserved for gold dogs. The remaining 90% are open to any eligible dog, regardless of breed, and that includes mixed breed dogs. So what are the steps for enrollment? Well, first, we have to determine eligibility, and dogs must be healthy and at least 5 years old. So we're looking at adult dogs. We're not looking at young adults or puppies. There is no upper age limit, although we think that there's going to be a particular age for any particular dog or breed where doing the test probably would not be worth it. You probably wouldn't run this test on a 13-year-old dog unless it was a really, really healthy 13 and it, by all criteria, had another 5 or 6 years to live in a healthy state. The dogs have to weigh at least 10 pounds so that we can get enough blood from them. They have to live in the contiguous 48 states of the US because we're using overnight shipping by FedEx, and Alaska, Hawaii, and other places will not meet the criteria of being able to do overnight shipment and have it arrive in the lab as we need it. The dogs must not have evidence of any previous cancer. So we ask people to be very honest about whether the dog's been diagnosed with any cancer. If the answer is yes, the dog will not be eligible. We want healthy adult dogs. The dog must not be undergoing treatment for chronic infections, for example, tick-borne disease, autoimmune conditions. And a vet or a vet tech, so a veterinary health professional, has to attest that if the dog has any lumps and bumps, they are not cancerous. Okay? So most of the time, vets or techs will do that through a physical exam. Okay? And they can be of any breed, sex, and neuter sex. Like I said, 10% are reserved for Goldens, 90% anybody else. Okay, the owners must complete every item on the enrollment form, and we're going to go through it momentarily. Be willing to respond to short semi-annual health surveys for the life of the dog. So you will be getting emailed surveys. They're really short. I'm going to show you what they look like, but we need you to respond to those. We've had really good responses for Shine On and for co-ed, so hopefully LyRA will, I think we got like 98% responses from Shine On and about 96 for co-ed. So if you guys want to be part of LyRA, let's beat that 98% and get it up to 100. Owners have to be willing to provide additional samples from their dog if requested. So a number of dogs will be tested again. And they need to understand and accept that there will be no reporting from the study. Now, there's a pre-enrollment survey. And to access this pre-enrollment survey, you go to this address, z.umn.edu/LyRA3. And it's really important that you enter LyRA 3, because if you just enter LyRA, it'll take you to LyRA 1, phase 1. And your dog will not be eligible to participate in LyRA 1. So you will just get frustrated. So remember z.umn.edu/LyRA 3. And remember, this is being recorded so you can go back and get the address later. Okay. You will click the radio button that says I'm interested. And the survey will let you know if your dog is or is not eligible. And it will let you know if any part of the form has not been completed. And once you complete the survey, you'll receive an email confirmation of completion. Okay, so we need your email address to be able to do that, which will be in the survey. And remember, just because you complete the survey doesn't guarantee that your dog will be able to participate. Okay. So this is what the homepage looks like. When you go to that address that I gave you, it'll say LyRA 3, blood collection study for lymphoma. And down here, there's this radio button that says, I'm interested. So when you click, I'm interested, it takes you to this eligibility questionnaire. So read the instructions carefully. And then you can go ahead and start filling things out. So the first question is, what is your email address? So you fill your email address. And then it says, what is the date of the survey? You can click this little thing that says now, and it'll automatically populate it to the date that you're doing this, so you don't have to, go back and look at your calendar or guess. Do you and your dog reside in one of the 48 contiguous U.S. states? If the answer is no, it'll kick you out. If the answer is yes, you can go on. Same here. If you don't enter a date, it'll kick you out or won't let you proceed. If you don't enter an email, it won't let you proceed. And then it'll ask you, what is your dog's birthday? So if you don't know, give us your best estimate, but we need a date. If you don't enter a date, you can't go forward. If the dog is younger than 5, which is calculated by a computer on the other side, it'll say, we are sorry, but your dog does not qualify for the study, and you're done. Okay. So dogs have to be 5. If in fact you enter a date that makes your dog over 5, the computer will calculate and it'll let you go on. So it'll ask you a few more questions. First is, which of the following is true? My dog weighs less than 10 pounds. If you say yes, we're sorry, you don't qualify. If you say no, I'm sorry, if you say my dog weighs 10 pounds or more, then you can go on. What is your dog's breed? So here, if you say golden retriever, there are certain specific questions. The question is, do you have an AKC number or a pedigree that we can obtain? So you don't have to have one. If you have one, you go into the 10% Goldens until they fill up, and then you go into the 90%. If you don't have one, you can go into the 90% that's not reserved for purebred Goldens. Did you participate in the lifetime study? So if your dog participated in the lifetime study, we're already going to be getting samples from them. So we don't want to duplicate and take samples away. So if your dog participated in girls, please don't try to enroll them because you'll get booted out. And then if you actually click another breed, so other purebred or mixed breed, if you have other purebred, it'll ask you whether you have a pedigree or an AKC registration number. Again, you don't need one, but if you have one, we'd love to have it. You can click mixed breed and it'll say, what kind of dog do you think your mixed breed is? Can you tell us? In this case, the answer was a golden doodle. And then the next question after you get through that is, has your dog ever been diagnosed with cancer? If the answer is yes, you get booted. The answer is no, you can continue. Is your dog currently healthy and free of ongoing disease? Again, if you click yes, you can continue. If you click no, you get booted. Does your dog have any undiagnosed lumps and bumps? We want dogs that don't have lumps and bumps. So again, yes gets you booted out, no keeps you in. And then, is your dog currently being treated for a tick-borne disease? The answer would be yes or no. And then if no, what conditions or medicines will your dog be taking? And so you have this line here that you can fill out. So in this case, frontline for flea and tick prevention, HeartGuard for heartworm prevention. And then the study has funds to cover sample submission kits and shipping, but we do not have studies to actually pay the vet for the blood draw or the office visit. So the question is, are you willing to help us and bear these costs? Unfortunately, we do not have a budget to actually pay for everybody's exam. So if the answer is no, don't feel bad. But we can't allow your dog to participate. We recognize this is an issue. Diversity, equity, inclusion, we're all for that, but in this case, it's a budget issue. And then to be included, you have to work with us to make an appointment to get the blood drawn, to make sure that the vet will be able to fill the tubes of blood so that your dog is big enough and easy enough to get blood from, and that the samples can get FedEx to us overnight. So will you be able to work with your vet to make sure that this happens? The answer is yes, you can keep going. And then, are you willing to submit surveys every six months, twice a year? And if you get that far, then you actually give us your name, your dog's name, your contact information, your address, and you submit. And if you get this far, you will actually get this notice that says, thank you for taking the time to submit an eligibility, and you'll get an email that says you submitted. Okay, so again, completing the pre-enrollment survey does not guarantee that you will be invited to participate, because we expect we will get more than 150 people that want to enroll their dogs. So the next step is randomization. Once we get a critical number of eligible dogs, but before we start scheduling, we're going to randomize that list. So rather than just saying first come, first serve, we're going to take the list and we're going to assign everybody a random number, and that random order will then be assigned numerically. And so the 47th dog might be the first one, and the third dog might be the second one. It's all random until we get to 150. Because dogs will be randomized from these completed surveys, they are not going to be enrolled in the order that their surveys were received. So if you are busily trying to complete your survey right now, it doesn't guarantee that your dog is going to get in, because there's going to be randomization. Okay? Now, this is really important. We have faced this on all of our studies. Please do not cheat or try to get to the front of the line, because it creates problems for everybody. So if you fill out multiple surveys for your dog, it's not going to actually increase the chances of your dog getting selected. It's actually going to cause problems with the red cap system and tie things up in knots. And then we have to go and fix them. So please don't make it difficult for us and for other people by filling out multiple surveys. It's not going to help. Okay? Please, please, please don't do this. Also, the process is slow. We are not a giant Amazon. We're a small lab, and there's only so many samples that we can process at any one point in time. So a few samples a week. Please, please, please be patient with scheduling. So if you don't hear from us, don't assume that bad things are happening. Just be patient. We will do everything we can to let people know if they're in and when they're in. With 150 samples required, it could take us weeks or months to contact every owner and schedule every dog. So again, be prepared for the fact that you might not hear from us for several weeks and maybe even several months. And when and if we do contact you to offer enrollment, we will do our very best to find convenient dates that work for everybody. So sometimes we actually schedule blood draws several months out to make sure that the vet has a slot, that it works for the family to take the dog to the vet, and that we have open slots to receive samples those days. Okay. We will almost certainly receive surveys for more eligible dogs than we have slots to fill. So for Shine On, we had over 800 applications on the first day and a half for 200 slots. This is kind of a high quality problem. It allows us to fill the study efficiently, but it makes a lot of people upset because they didn't get on. So remember, we are going to randomize, and there will be more surveys submitted than we can actually fulfill. Sometimes what happens is that over time, some of the dogs we randomized might have an accident, or the owners might decide they don't want to participate. Circumstances might change. So there's a good chance that we'll actually go past dog 150 to get 150. And then to make it possible for the largest number of families to participate, we are limiting the enrollment right now to 1 dog per household. It's really not fair if a lot of people want to be part of this for one person to, sort of get 10 dogs, even though it's kind of efficient in terms of, the cost and the shipping. We want to make this as broadly representative as possible. So we want to get the largest number of people, families to participate. Okay, so what are the steps for sample submission? Mitzi in our group will contact owners individually by email using the randomized list. And her email will recap what samples are needed for the study, how they need to be shipped. It'll include a copy of the informed consent form as an attachment. And it's really important that you actually open that attachment and print it out. The email will remind you that the submission requires signed confirmation at the end of the informed consent form from the vet or the vet tech or the practice where the samples are collected. So you have to take the physical consent form with you and have them read it with you and sign it. Part of what they're signing is that they performed the physical exam and that the dog was in good health. Okay. The email will usually offer 2 dates, asking you which of these would work so that you can send the sample. And both of them, what we ask is to actually take the dog to the vet early in the day so that we can make the FedEx cutoff for overnight shipping. If neither one of those dates work, it doesn't mean that you're out. We just work with you. So you contact Mitzi and say these dates don't work, and Mitzi will work with you to find an alternative date. The email will also want you to reply to confirm that you actually agreed to the date and time of the appointment. And you will provide the vet clinic contact information so that Mitzi can ship the sample collection kits to the clinic before the appointment. And as a rule, we ship the kits only to the vet. So we ask you not to tell us to please ship it to you and then you'll take it to your vet, because that creates all sorts of problems for us. So we will need your vet's address. There will be details of the kit's components, how to get the samples. So we actually have some instructions in case the vets want to know, like, which vein, how do we want to get it. So everything that's in the kit, how to get the samples and how to ship them, there will be instructions in the package, and we'll send that to the veterinarian in the kit. And they may also be included in the email that you can provide to your vet in advance. Okay. The consent form will be attached to the email. Again, you need to print it physically. You need to complete the informed consent form. You need to initial each page at the bottom. It's really important. A lot of people forget to do this, and then we have to send it back to you and get you to read it to initial. And you need to take it to the appointment for the vet or the vet tech to sign. And if we don't get a completed consent form, we cannot use your sample, so your dog won't be part of the study. So we don't want people to go through all this, complicated process, spend their time, spend money, and then end up their dog not being there. So please, please, please remember to fill out the complete consent form, including initialing every page and making sure that the signatures are present. Okay. Once the enrollment process is complete and a date is selected, then Mitzi ships the sample kit to the vet clinic at least a week prior to the sample collection to make sure that the kit gets there and it's ready for the appointment. And after shipping the kits to the clinic, Mitzi will send you the tracking numbers to make sure that you can track and make sure that the kit got there and remind you of the date that you're supposed to go to the vet. On the appointment day, take your dog to the vet, complete the informed consent form, and bring it to your appointment. Your dog does not need to be fasted, so there's no special things that you need to do in terms of withholding breakfast or anything. Your dogs can be happily fed. Please give the entire consent form that you have already filled out and signed to the vet or the tech, or you can read it with them to make sure they can explain anything you don't understand. We can also do that for you. They need to review it as they collect the samples, and they need to sign. They need to sign the last page of the consent. And again, it's really important. It's not signed, we can't use the sample. Okay, so if we don't receive the entire completed and signed informed consent with the samples, the dog will not be part of the study. And when this happens, it makes people very upset. So remember to fill out the consent form. Okay. Then the samples need to be returned to us for processing on the scheduled sample collection day by overnight courier. We pay for courier. There's an actual waybill that you can attach to the kit to send it back. And it already has the payment information, so there's no shipping associated with this, shipping costs. And remember, we cannot pay for the vet appointment or the sample collection. We do pay for shipping. There's two options for overnight shipping the samples. First option, which we prefer, is that when you schedule the sample collection, you ask the vet clinic to schedule a FedEx pickup. So FedEx will actually come to the clinic, pick up the box, take it, and done. So we want that happening on the same day as the sample appointment, and we ask you to do an early appointment so that you make the FedEx cutoff. That in some places is as early as 2 o'clock in the afternoon, sometimes even earlier, sometimes 1 o'clock. So I want to make sure we make that priority cutoff. The alternative is if you can't make the cutoff or the clinic won't ship it for you, you'll need to find a FedEx office and take it to the FedEx office in the same day as the sample was collected to make sure it actually makes that cutoff. And we would very much appreciate if you go to a FedEx office rather than just dropping it in a Dropbox, because a Dropbox might say that the cutoff is 5, but they might have come at 4:30. So we want to make sure we get the samples. So the intent is that all of the healthy dogs that are enrolled in the study will be followed for their lifetime, or at least a long part of their lifetime as part of the study. So there will be a survey, and every 6 months, a RedCap system will email you a survey that's very brief and relatively easy to fill out. The survey will ask if there have been changes in your dog's health. For example, is there a new diagnosis of cancer or any other serious chronic disease, new medications, has your dog passed away? And we know this can be very emotional for people that lose their dogs. We recognize that it can be difficult to fill this out. We're very empathic. If you get the survey and you're not up to filling it out, just set it aside, and hopefully if you can go to it later when you feel that you can do that. If you can't do that, just let us know, because it's really important for us to know something as opposed to know nothing. So we're not trying to annoy you or rub in the negative emotions if your dog has passed away, but it's really important for us to know this. So if you move or you change your contact information, you need to inform the study coordinators, currently Metsi and Kathy, so that we can actually change that information in RedCap and you get the surveys. So, email, physical address, phone number change, etc. Okay, we'll ask you to provide diagnostic reports for new diagnosis or to give us permission to contact the vet that made the diagnosis so that we can get the records and the reports. It's really important. If there's a reason why you choose not to do that, let us know. We understand there might be special circumstances, but generally, this information is critical for us to be able to assign the right diagnosis to a dog with a particular risk. We will ask for repeat samples from a predetermined number of dogs that will be randomized. If we ask you for a second sample, you should not interpret that there's something going on and that your dog was positive or high or something. We learned in Shine On that we didn't make that very clear, and virtually everybody from whom we requested a second sample through randomization thought that it meant that their dog was positive and was going to get hemangiosarcoma. So if we request a second sample, we don't want you to be really upset, think that your dog's going to get lymphoma. This is predetermined and it doesn't mean anything. We're just trying to understand the stability of the test over time. So what does the survey look like? You'll get an email that looks like this. There will be a link that you click on to get to the survey. What you see when you open the survey, the first thing on the top left in the blue box, in the blue box right here is follow-up. So it'll be 6 months, 12 months, 18 months, etc. Then we have a question that asks you how you prefer to be contacted. So email or phone, hopefully email. It makes our life a lot easier. Is the email that we have still correct? Hopefully it is, because if not, you probably didn't get the survey. And then we need to actually ask you whether your dog is alive or dead. And then we have a line that tells you what you told us, what medications you told us your dog was on. So this is pre-filled in the survey. And we want to know if the dog continues on these medications and has new ones. This current medication box will not be pre-filled. So please, if your dog is still on the medications that you pointed out here, just copy and paste those from here to here or retype them. Otherwise, we will assume you're no longer giving these meds. And when we go back and we try to do data analysis, we will be wrong, because if the dog was taking those meds, we won't know that. Okay? So if there are more meds, just add them in the columns. And if there's more than you can account for here, you can just add them in this line right down here. Okay. Then we'll ask you if your dog had a cancer diagnosis. Okay. So that is this box right here. If the answer is yes, we're going to ask you what type of cancer, how was the cancer diagnosed? Was it a biopsy? Was it some other way? If it was another way, what was it? What was the date of diagnosis? And then may we contact the vet where the diagnosis was done so that we can get those records, okay? And the same thing is true for chronic disease. So if we will ask, has your dog been diagnosed with a chronic disease? The answer is yes. We'll want to know the date. We'll want to know the type of disease. So it may be one of these, or it might be something else. And may we contact the vet? Hopefully you will tell us that we can. And at the end of the survey, that's basically the end of the survey, you'll get a note that says, thank you for completing the survey. See you in 6 months. Okay, so that's essentially the part that you will be involved with. And then we get the samples and we work our magic. And what's going to happen to reporting? Well, much as we would like LyRA to be a perfect crystal ball, it's not going to be a perfect crystal ball. We know it's not going to be perfect. We want it to be good or great. So we expect that the LyRA test will have high accuracy, that means sensitivity and specificity, to identify the relative risk of a dog to develop lymphoma based on the presence of a lymphoma permissive environment. With Shine On, we can actually say that a dog is somewhere between 7 and 15 times more likely to develop a malignant tumor, possibly hemangiosarcoma, but other malignant tumors, than a dog that tests low risk over a particular time period, like 1.5 to 2 years. So that's sort of what we're looking for. It's extremely important to note that the risk of developing lymphoma doesn't mean that the dog will develop lymphoma. As I told you for Shine On, high risk 18 months means 25% probability yes, 75% probability. So high risk does not mean that your dog will absolutely develop lymphoma. Okay? And remember, these are expected study results. This is not what we will be reporting to you. This is what we think will happen at the end of the study. Okay? Will the test results be reported to owners? Categorically, no. Don't even ask. There is no reason that we would be convinced to give you the results, because we don't really know what the results mean until the end of the study. So this is an experiment. And until the end of the experiment, we don't really know how well the test works. So giving you a result that we don't know how it works would not be ethical. And we also don't have an intervention. So even if we knew that the test was really accurate, if we basically said your dog is at high risk to develop cancer, have a nice day, that's not really cool. There are other tests in the market. If you're interested in early detection, there are tests in the market, and we can have a discussion about those. We can refer you to those if you want to use them. Again, there's no intervention. So if you have an early detection, but you don't know where the tumor is, then you're faced with decisions, right? And those decisions can be costly and anxiety creating. So, but there are tests out there. So if you're looking for an early detection test, we recommend that you go for one of the companies that are doing early detection, and we're happy to have that discussion. This is not what LyRA is. LyRA is developing a very accurate test that will then have a paired intervention. Okay. So how will you learn about the progress and results of the study? How will you know that we're actually doing something and not just, playing solitaire on our computer? Well, we provide regular reports to Morris and to the Golden Retriever Foundation. And they're very diligent. If we don't report to them and they don't, or if they don't like what we report, project ends. So we have to be very good about reporting and showing that we're making progress. We will also disseminate the results through professional channels. So we will present data at meetings, and as appropriate, we will write papers for the scientific community and publish them in scientific journals. And as appropriate, we may hold informational webinars like this one, or we may disclose emerging or interim results at specific gatherings, such as national or regional specialty shows and other dog-friendly venues. We travel a lot. So, if your group is having a show with critical number of people at some particular place, you can contact us and we can arrange, maybe do Zoom or maybe do in person. So we're very willing to try to work with you guys, but we also need to have something to report, right? So it's going to take a little bit of time before we actually have something to report. So with that, hopefully we met our objectives. First, describing the goals of the LyRA study, providing information about opportunities for enrollment and participation, and aligning the expectation of people that are interested in having their dog participate with realistic project timelines. And what I hope you'll remember is when you're thinking about lymphoma, it's not one disease, it's more than 30 diseases. Our goal is to develop a test that will stratify or categorize these dogs based on the risk for the most common malignant lymphoma type. We might actually be able to do more than one type. The LyRA 3 study will enroll approximately 150 dogs that meet specific eligibility criteria, and there will be no report. Okay. So I just want to make a note that philanthropy drives our work, and you can join us in the fight against cancer. If you're interested in donating specifically to the study, you can go through GRF. Wonderful supporters of us, you can go through MAF, wonderful supporters of us, and you can go directly to the University of Minnesota, where you can actually, visit our website or contact Jan Scholl, whose email is here. And one notice about our website is we are changing our hosting. And so hopefully this will have a redirect. But if you don't get redirected, just send me or Mitzi an email and we can provide the right link. And with that, it's not what I wanted to do. I just took me to the link. Okay. We will open for questions. So thank you. Thank you for your attention.
Hey, Jaime, I am going to jump in here because I have been monitoring some questions and I have a couple. Are you ready? First, a commercial from our good friend Beth Bernstein, who, hi, Beth. Beth's been in girls, and she wanted everyone to know that Shine On owner here. This is pretty identical procedure-wise to Shine On. This is really easy, and I encourage you to participate. Thank you, Beth. They are easy to work with, and Mitzi is awesome and always answers questions. So a little thanks, Beth, for that support. So Jaime, I have a couple questions. Some are mine, and some are ones that I've told people to hold. So are you ready?
I am ready, but before that, I will say Mitzi is awesome. So
Mitzi is
agreed.
awesome.
Mitzi is awesome.
So I have a question for you on, you talked about cancer and that these dogs cannot have been diagnosed with cancer before, but I'm going to throw a little wrinkle because we all have dogs who have had mast cell tumors. And as we know, there are high grade, low grade. How do you feel about mast cell, or is that an exclusion?
Mast cell will be an exclusion.
Okay.
So we hate to tell people that want to help us no, but we need clean data. If we don't start with clean data, we will not get a good answer. So in order for us to take dirty data, we would actually have to do the study on something like 14,000 dogs. And we just don't have the bandwidth to do 14,000 dogs. So if you have a dog that had a mast cell tumor, that had squamous cell carcinoma, that had a perianal adenoma, that, whatever it is, The answer, unfortunately, is going to be no.
Okay, that's good to know. Okay, another question that we talked about, you mentioned healthy dogs. And for those of us like me who have a geriatric dog, and maybe have orthopedic issues, or even a young dog with like a, let's say, elbow dysplasia, are those chronic conditions that would keep the dog from being enrolled? I looked at your list and you talk about heart disease and like kidney disease, but what about those kind of
Generally no. So if you have any questions, so if on the enrollment form, just if you can just list what the condition is to the best of your understanding. And some of them are going to be easy. So for example, hypothyroidism is kind of a chronic disease, but it is so common and kind of overdiagnosed. So we have decided that dogs that are on thyroid supplementation are eligible. So that's easy. We are going to say that sort of run-of-the-mill osteoarthritis due to aging or even due to congenital or heritable issues is probably going to be okay. But something like canine diabetes that requires insulin will not be okay. So some of those are going to be, there's going to be a little bit of a gray area, and the investigators will basically powwow us. We get these surveys, and we actually run. So Mitzi usually sends out an email to the investigators and says, here's the situation, make a decision. So we all get together, pros and cons, and then we decide, and we let the owners know.
Okay, that's great. And that's actually, I have a question for you that came in that talked about in the medications, specifically supplements. They mentioned Desiquin, probiotics, but what about those?
Yeah, so supplements are tricky because we often don't know what's in them, and we don't know how they change the systemic environment. So for some of the most common ones that people use, like Fortiflora, sure, it's okay. We're not going to exclude dogs for Fortiflora, or Cosequin, or the joint things, whether they work or not, they're so widely used that we're just going to say okay, because whatever influence happens is going to go into the training set. If people tell us that they're taking things like turkey tail mushrooms or hyperimmune supplement or stuff like that, we are probably going to say no. And as I say this, I'm going to ask people, please don't omit that. If you have a long list of supplements, maybe just write supplements, and then we might need to communicate with you to say which supplements, because otherwise the list of 40 things in the email drives everybody crazy. So if it's a common supplement like Cosequin or Desiquin or Fortiflora, just write it and it'll be okay. If it's a long list of everything that you can get off the shelf at GNC, we probably need to evaluate those. We don't really know if they do anything or what they do, and so we just, again, we need to be careful to get clean data.
Okay, and I had a couple questions about age range and if there's any age exclusions. Can you speak to that?
Yeah, the dogs have to be over 5. And the reason they have to be over 5 is because for many dogs, but not all dogs, dogs of average and larger size, the cancer risk sort of begins at the age of 4 to 5. So when we shrunk dogs to make little breeds, we also decelerated their aging. And we know that little dogs tend to get less cancer over their lifetime, and when they do it, the risk starts later. So we will have some little dogs here because they can weigh 11 pounds, and that's not a very big dog. But we're sort of going with sort of the average because we can't actually create breed specific age ranges or weight specific age ranges. So sort of the 5 and forward is the age where risk starts increasing from just a little bit to a lot. So dogs have to be older than 5, and we don't have an upper age limit. If you want to enroll your 17-year-old poodle, go for it. It's fine. We will take them. It'll be interesting actually to see what happens with age, because one of the things that we might be measuring, one of the variables that we might be including in the training set will be age. So we do want the diversity of aging, but we think if this goes to the clinic, we would try to use common sense and practicality and say for dogs that are in the advanced senior stage, you probably don't really need to run this test. But right now, there's no upper age limit.
Okay, I'm not looking on this. Someone asked a little bit about why you weren't going to collect fecal samples as part of your thing. And I'm like, go for it because I am a gastroenterologist by training. So, Jaime, how come no poop samples?
Yeah, that's actually a really simple question. It's technical. The way that you have to collect and handle the sample to get metagenomics is really, really specific. So if it turns out that we get a phenomenal metagenomics signature, we are going to approach Morris and GRF and find a way to actually add, edit, or modify the study and get more cases that include those samples. But the sort of the learning curve to actually collect the samples appropriately so we can use them right now is really difficult. This is not, I've never done Cologuard, but I assume that it's got some instructions that almost anybody can follow. The instructions for how to collect poop for this particular study are really, really involved, and something that vets would frown upon because it's time consuming and laborious. And so that's the reason why. It's not because we don't think it's going to be important. We actually think it's going to be really important. But we actually need to see what happens on the training side.
Yeah, and I will support Jaime on this one. For those of you who know about the Golden Retriever Lifetime Study, we have collected fecal samples forever. We said pop them in a tube, great. We froze them as -80. And then we realized that's, as Jaime alluded to, as we know more about evaluating stool samples, it gets trickier. First of all, poop kept at -80 degrees Celsius requires a diamond saw to cut it. And the samples do not like to be freeze thawed. The bacteria do okay, but some of the, as Jaime alluded to, some of the metabolic products, if you want to look at metagenomics, don't love that. And so it is a much more difficult sample to handle now. And if we had a crystal ball, as Jaime alluded to, and knew now what we knew back when we started, we would have had the samples in different, like, divided up and in different ways. We will overcome, I'm sure, this obstacle. We'll have to probably do everything at once sometimes. And, if Jaime wants to do it, like, we'll give it out, but everything's going to maybe need to be. So I love the question, but I understand the difficulty with that. And I think that's just about everything. I did have somebody, if you don't mind, Jaime, who asked me a question about, have you been able to assign risk with DNA and RNA from Shine on the hemangiosarcoma? Like, kind of where are you
Yeah,
right
that's a
now?
really good question. So Shine On uses a different platform that's called flow cytometry. And one of the challenges of Shine On is that we need fresh samples with happy live cells to actually do the flow cytometry. It doesn't work on it. In order to do fixed samples, we would have to basically redo the whole study and train on fixed samples. There are some issues with the antibodies not really working on fixed samples. So we are actively working. So for those in the Golden Retriever Foundation board who recently might have just received our final report, they will know that we're actually trying to translate the platform from flow to PCR so that it's lab friendly and less expensive. And that's ongoing work. So Shine On right now works on a flow cytometry platform. Maybe in the future, and ideally, if it gets out to commercial deployment, assuming the interception works and we can align all the stars to get, the right private corporate support to actually make it out there. We would be really happy if we could translate the platform from flow to PCR, but we won't know until we complete the experiments.
Hey, are you up for one final adjacent question, which is it's a T-zone lymphoma question.
Sure.
Is it unique to Goldens?
No, it is not unique to Goldens. It was originally characterized in Goldens because the samples that so the first reports of T-zone lymphoma came from Ted Valley in the mid 90s, and it was a real controversy because um, a lot of pathologists looked at these tissues, and most of them said that the process that was going on was sort of a reactive process in response to an infection of some sort, like a bacterial pyoderma or something like that. So Ted had to swim against the current to actually convince people that this was a real condition and not, um, something made up. Um, we were able to start working with Ted in the mid 90s, and we were doing a project with Matthew Breen at the time, focused on Goldens and Rottweilers. And so we had a very, very large collection of lymphomas from Goldens, which had some preponderance of T-zone lymphoma. So it was originally reported by Ted and by us as something that we saw commonly in Goldens, but not necessarily exclusively. And then Ann Avery's lab at CSU has sort of taken on that ball and run with it and characterized ways to diagnose the disease much more easily using flow cytometry rather than biopsies, and followed up their outcomes with and without treatment. So there's a lot of data out of CSU and also out of Davis Seelig here at the U of M that really have sort of been the experts on this disease. And again, I think we see a lot of Goldens because the community is educated, and when their dogs have lymph nodes that are a little bit big, they're probably more likely to go to the vet because they've heard about this. Vets are very attuned to the fact that this happens in Goldens, but it's diagnosed in dogs across the spectrum. And so I think that as we get more education and more people looking for it, we're going to find more. So it's not a golden retriever disease. It's not a genetic defect in Goldens. And again, for most T-zone lymphoma cases, you treat them with a pet and a cookie. Some dogs that have clinical signs will need therapy, and most of the time the recommendation is to do sort of conservative low intensity therapy and not go for the aggressive therapies. There are some people who believe that aggressive therapies will make the T-zone lymphomas really angry and they'll progress on to become more like aggressive lymphomas.
Okay, well, that is everything. So you got everything. So thank
Cool. And
you.
we did it, and we went over the allotted time by 2 minutes. So it's pretty amazing. Thank you, Kelly, for moderating and for all the questions. Thanks to everybody who attended. We still have a number of people who are hanging on. And if there are any questions, you can reach out to us. If you email us, please be patient. We get a lot of email traffic, and we try to answer everybody's email, but it may not happen right away.
I do want to say that the YouTube video, when I receive it, will be put up on the Golden Retriever Foundation YouTube channel, and there'll be a link on our Facebook page. And that's Golden Retriever Foundation Facebook page.
And we will also be sending this out for those of you who are in the Golden Retriever Lifetime Study. It'll go out in the next monthly email, a link to it as well.
Yeah, thanks for that. And just to note that once we close enrollment, when we get to 150 plus, we might actually suspend the video so that we don't keep getting requests after we are done. So if anybody goes to the video and it gives you a no link, the reason is that the study will be either on hold as we go through our enrollment, or it'll be full.
We can modify the slide. We could
Okay.
probably modify the slide.
Cool.
Because the first part of it is very informative about lymphoma in general and what people need to expect. We can put another slide in. It's not a problem.
Great. Thanks. I appreciate that, Chris. All righty. Thanks, everyone. We appreciate you. And before we leave, I want to do a shout out to Andrew, who hosted us and really arranged all this. And he was absolutely amazing. So thank you, Andrew, for making this possible. the U of M is a better place because you work here with us. Thank you.
Thanks, Andrew.
Thank
All
you.
right. Take care, everyone.
Thanks, Jaime.
Bye.
Bye-bye.